The following is an analysis of Riverview, Florida. Riverview was settled along the southern side of the Alafia River in the 1840s by a soldier pioneer. At that time, the community was known as Peru. The first Methodist church was built in 1850 and was the first church of South Florida. During the same time period, the first ferry became operational to cross the Alafia River and connect the north and south sides of the river. The majority of families raised cattle, planted citrus groves, and logged. In 1885, Riverview was established on the north side of the river. At this time, phosphorus was discovered in the Alafia River, which means river of fire, due to the phosphorus glowing at the bottom of the river bed. And the Tampa port became the main shipping port for the mineral. Peru and Riverview were sister cities until the 1940s when they combined into Riverview, Florida. Riverview is a residential area that is being developed at a very fast rate. The majority of the houses and buildings have been built recently, and the neighborhoods are majorly divided into subdivisions. The area is mostly kept up neatly with sidewalks and community playgrounds. This is a positive benefit as the building structures and communities are built up to the newest hurricane, wind, and flooding requirements for prevention and disaster preparedness. Members of the community were interviewed regarding the quality and condition of the houses and community layout. The consensus was that the homes themselves were in excellent condition. The major issue is the overpopulation in the area. A local realtor stated that there is predicted to be a shortage on housing inventory within the year. The structure of the roads in Riverview are in good condition as the majority of the roads have been made as the community develops. The roads have designated bicycle lanes, which promotes exercise. The major issue noted by members of the community is that the roads are excessively congested and are unable to accommodate the large influx of population growth. Although the roads are designed to conveniently access the major highways for commuters into Tampa, the congestion causes delays that more than double the driving time. When speaking with a community paramedic, another issue regarding the traffic congestion is that it impedes access of emergency vehicles. Regarding public transportation, there is bus access on the major roads that goes throughout Hillsborough County, although is not accessible from residential neighborhoods. During the survey, I noted majorly fast food restaurants, which have poor quality menus. This, combined with the increased time away from home for the busy working families, increases the intake of the fast food option and is an area of improvement. The grocery stores in the area have options from processed foods to fresh produce and are the primary food source. There's a limited amount of organic options that members of the community have identified as important, and there is minimal farmers markets for fresh local produce. Issues concerning the population include the growth rate of Riverview in the last 10 years, which is 129.1%. With such a rapid growth rate, the community's infrastructures are unable to sustain the necessary resources. Examples of this are issues previously discussed, such as housing, roads, and traffic congestion. The grocery options are also congested to the point of limited supplies in time of emergency. An example of this is during the 2017 hurricane season, there was not enough water, gas, or ice to sustain the population. Florida is known for its seasonal residents. Issues regarding these population changes on the community is staffing of medical resources to accommodate the influx. An issue for the seasonal population is continuity of medical care, as the majority of their primary medical care is in their home state and not in Riverview. Riverview is an extremely diverse community regarding race and ethnicity. While this is not an issue in itself, it is a fact that needs to be taken into consideration when planning for the community, as each culture has different needs. The top two leading causes of death are from heart disease and cancer. Healthy behaviors noted during the Winchell survey are that there are numerous fitness centers in the area. A benefit is that there are multiple fitness centers that are open 24 hours. There's an option for women to go to an all-female center that provides childcare. Members of the community take advantage of the temperate weather and can be seen walking, running, and biking outside in the neighborhoods. Unhealthy behaviors noted in the area are the amounts of the population that are overweight or obese. During my survey, I noted the fast food restaurants, and the majority of adults do not have an adequate fruit and vegetable intake, and this is consistent with the study done by Kirkpatrick on the same issue, which shows the correlation of these fast food restaurants contributing to poor nutrition. Another study done by Dinkel shows that focusing on the nutrition of the family, children, and parents has a greater success than focusing on the individual. A family-based intervention that has been successful is the Healthy Families Initiative, which educates family on proper nutrition as well as budgeting and the affordability of nutritious foods. The availability of health resources in Riverview varies in meeting the population's needs. There's a brand new hospital, St. Joseph South, which opened in 2015. The hospital is currently already expanding to meet the needs of the growing Riverview population, with a final completion date expected by 2020. There are many options for outpatient care, from primary care providers and pediatrics to specialties such as OB/GYN, cardiologists, and gastroenterologists. Baycare has a medical group stationed right in front of the hospital for convenience of follow-up care. One issue that stood out from interviewing community members is the length of time an individual had to wait to see a specialist or even their own primary care doctor. While there are outpatient offices in the community for mental health treatment and counseling, there are no acute care facilities. St. Joseph's Hospital's Psychiatric Care Center is located in Tampa. The acute care facilities will bill the patients for their treatment, but they will provide care for everyone regardless of their ability to pay. The physician's office uses traditional insurance. Services provided for members of the population who are underinsured or have no health insurance include the Ruskin Health Clinic and the Florida Department of Health. While these facilities are not in Riverview, they are in the adjacent town over. The clinics provide a full spectrum of services to all ages and will provide care for all people and not turn people away if unable to pay. Although both of these clinics are feasible options, neither clinic is in Riverview. Riverview needs its own resources to provide care for the vulnerable populations in the community. Other social services include Healthy Start, which provides medical care to pregnant women and children under 3 and is free of charge for qualifying applicants. The Salvation Army, which meets human needs to all ages and populations without discrimination. Their services are free and they are always open. Although these services seem adequate to meet the needs of the community, during the Winchell survey, homeless individuals could be seen asking for food, money, or work on the side of the road, which would indicate more resources are still needed. There are 3 Healthy People 2020 objectives for Riverview, and they are: first, poor nutrition from fast food restaurants associated with individuals being overweight or obese. Per Healthy People 2020, an objective that correlates with this issue is increase the proportion of adults who are at a healthy weight. This objective supports the scholarly research previously noted regarding the increased intake of poor nutrition of busy families resulting in an overweight community. Another issue noted from the previous discussion is the need for availability of mental health resources. A Healthy People objective concerning this is increase the proportion of adults with mental health disorders who receive treatment. This issue is important as there are no acute mental health services in Riverview. Third, access to health services is a community issue. As noted in Healthy People 2020, an objective is to reduce the proportion of persons who are unable to obtain or delay in obtaining necessary medical care. Wait times to see the primary care provider or outpatient specialist are impeding continuity of care for members of the community. The water quality in Riverview provided through the county is adequate as it meets all state and federal regulations. An issue identified from community members is that they would like to see increased use of reclaimed water for lawn and landscaping, as treated water is currently being used in the majority of new residential developments for lawn care, which is not cost effective. This situation also depletes the water supply unnecessarily. Hillsborough County treats a large amount of raw sewage per day. While this process adequately treats the water on a normal day-to-day basis, concerns have been noted during times of storms. The treatment plant can only handle a certain amount of waste and water at a time, and when this amount is exceeded, the only option is to dump the water into the bay. This causes issues such as red tide and causes harm and death to fish and other sea animals. Riverview has an adequate weekly curbside pickup of recycling products and solid waste. An issue noted during the Winchell survey is there are newly developed residential subdivisions being built at the base of the landfill. This indicates health issues that could result from the close proximity of garbage, such as Respiratory issues, toxins seeping into the water in yards where children play, and pathogens being released into the water, air, or soil. The police who serve the area is the Hillsborough County Sheriff's Office. There is not a police station located in Riverview. The closest station is in Ruskin, which is in the adjacent town over. The major issue with the police department is the response time, which is estimated at 11 minutes. During an interview with a local police officer, he stated that staffing is a major contributor to this issue. Hillsborough County has a complex and in-depth disaster plan in place, which is adequate for the community. But two issues of concern noted by residents of Riverview are traffic congestion when attempting to evacuate and an adequate amount of supplies such as gas, water, and ice to sustain the population. The elected officials are reasonably accessible, with each division having a website with their contact information listed for community members. Notices for public meetings are posted in advance to notify citizens of meeting times and locations. The budget for Hillsborough County is adequate as it incorporates all the needs of the community. The only area of concern regarding government and public policy in Hillsborough County is the allocation of the categories in the budget. During this analysis, traffic congestion has been a consistent theme throughout. 21% of the budget is allocated for transportation, yet the roads are not sustaining the population growth. Also, with response time of 11 minutes, the police department could use further budgeting to increase their staffing issues. There are 6 community needs for Riverview. First is the issue of poor nutrition and obesity. This issue is chosen as high priority because it affects people in their daily lifestyles and habits, as more families are eating out due to their busy schedules. This health concern is identified as an issue due to the multiple health risk factors associated with it. As noted previously, interventions the community health nurse can assist in implementing are educating families on identifying proper nutrition and picking out affordable items, as well as emphasizing focusing on the family as a whole to make healthy lifestyle changes rather than the individual, as changes with the family unit are more successful. The second community need is the issue of traffic congestion and the ability of the roads to sustain the population of drivers. This affects daily safety issues such as motor vehicle accidents, road rage, and impeding emergency vehicles. The community health nurse can assist with interventions such as participating in policy development with the elected officials and provide education to the community regarding seatbelt safety and anger management. The next community need is the environmental issue of building residential areas adjacent to the landfill. This is of high priority as it can affect the long-term health of the residents. An area of opportunity for the community health nurse is to assist in policy development to monitor the soil and water in these specific areas, and educate the residents of the importance of health screenings with routine visits to the physician. The evacuation route is a community concern that needs addressed. The traffic congestion impedes the exit of individuals attempting to leave. This could cause a problem on a large scale with people being stuck when a disaster occurs. Also, the immediate accessibility of the stores and gas stations running out of basic supplies needs addressed. The community health nurse can emphasize preparing for emergencies in advance of an occurrence when no disasters are expected and can work with members of the emergency policy group to assess further interventions for evacuations. Next, the community has a need for increased access to outpatient health services as well as mental health resources. It is important for community members to be able to access their primary physician in times of need so that they can have continuity of care. There are no acute mental health resources. The community health nurse can assist in speaking to the elected officials of the needs of the community. The final community issue is in regards to police response times. This affects the safety of the community in times of crisis. As this seems to be a budgeting issue, the community nurse can speak to elected officials on behalf of the residents. The nurse can also educate the residents on personal safety to assist in the prevention of crimes.